to the Winterhaven Chamber of Commerce's Ask the Doctor series. This series is done in partnership with Baycare's Winterhaven Hospital to give you, the community, an opportunity to get to know our local physicians, as well as the many programs and services that Winterhaven Hospital provides to keep our community healthy and thriving. On today's episode, we speak to Dr. Leah Shell, who will share about the family medicine practice and the FSU Residency program, where she works with Baycare. So, can you tell us a little bit more about your role at Winterhaven Hospital and in the community?
Absolutely. So I currently work, like I said, as one of the faculty physicians here at our family medicine residency program through Baycare. I have a few different hats that I wear. So my first hat that I wear is I'm a teacher. So I teach a lot of our incoming residents, our doctors in training, getting their specialty in family medicine. I teach them in the clinic and through academic lectures, just training them and shaping them to learn all the aspects of family medicine and how to deliver primary care. I also see my own patients in the clinic a few half days a week. So I have my own patient panel that I have the privilege to care for. And then the last hat that I wear is I also do OB and labor and delivery over at the Winterhaven Women's Hospital, which is probably one of my favorite parts, just to be able to walk through pregnancy with different women and then have the joy of being able to deliver their little ones.
Awesome. So where were you trained? I know you're with the FSU's residency program now, but where did you go to medical school and do your residency?
Yeah, so I'm a Texas native. I was born and raised in Dallas, Texas. I ended up doing my medical school at the University of North Texas, the Health Science Center. That's in Fort Worth, Texas. Did all of my medical school there. And then I went just a little bit north to Oklahoma, where I did my family medicine residency training at Tulsa, Oklahoma, at the In His Image Family Medicine Residency Program.
Awesome. So how long have you been practicing in Winterhaven?
So I moved to Winterhaven in September of 2021. So I've been practicing here since then. So not quite a year, but getting close. It's flown by. I can't believe it's already been that long. But when I first came here to Winterhaven, I actually was practicing as one of the physicians at Baycare Urgent Care. So I was at 3 different locations here in Winterhaven and Lakeland and in Haines City. So I was with them for about 7 months and then just transitioned recently over to do what my passion is, which is primary care here at Baycare.
Very nice. So why did you choose Winterhaven? I mean, did you just throw a pin on the map and said, okay, that's where we're going? Or did you research the area first?
So my story is very unique how we got here. My husband and I have been married, it will be 12 years in the fall, and he's been with me for all aspects of my whole training, all the way from undergrad, all the way through my residency. So he's been so amazing and following me around through the different places that we've trained. And after I finished residency in Oklahoma, I said, okay, it's your turn. I want to go wherever you want to go. We have a blank slate. You just tell me where you want to go. And he said, well, I've always wanted to go to Winterhaven, Florida. I said, I have no idea where that is, but Florida sounds great. So his story is he's a pilot and he flies seaplanes, which are the planes that have floats that land on water. And there is a world famous seaplane base here called Jack Brown Seaplane Base. And his dream has always been to be a flight instructor here. So it happens to be Winterhaven is actually the seaplane capital of the world. People come from all over the world to learn how to fly float planes. And so he said, I really want to go to Winterhaven to do this. So it happened to work out perfectly because I ended up finding my dream job through Baycare, which is going to have the ability to do what I love, which is teach and do OB. And the stars just kind of aligned. And so here we are, and he's teaching at Jack Brown's Seaplane Base as a flight instructor. And he feels like, he told me yesterday, he says, it just doesn't feel like work. It feels like I just get to do my passion. And I told him, it's funny you say that because it feels the same for me too. So we're here just kind of living our dream and have just loved being a part of Winterhaven.
Well, that is awesome. Well, welcome to Winterhaven. We're so glad you guys are here and that you have found your dream jobs here. So what do you like best about Winterhaven Hospital? And I think you've told us a little bit about what you like best about Winterhaven, but if you have anything to add, we'd love to hear it.
Yeah, so what I love best about the hospital, both Winterhaven Hospital and the Women's Hospital, is just the spirit of collaboration. I get to work with all different specialists from all different backgrounds, and I just love that spirit of unity that we share amongst the physicians, the staff, the different nursing staff, the social workers. Everybody plays their own part, and we are able to just do that in such a collaborative way. And I think that translates into wonderful patient care, and that's really the goal that we all have, is to provide the the best quality care that we have. And so when you have all of the team members kind of on the same page and working together, that allows us to really take care of our patients. So I love that aspect about the hospital. And it also translates into the community as well. We have felt welcomed here since day one, just especially not even being from Florida. The people here have just treated us like we're one of them. And it's been really, really wonderful. The community is very family oriented. There's a spirit of unity and that small hometown feel. But Winterhaven to me is unique because even though it has that small kind of community setting, there's still parts of it that are just growing and excelling. And, I look at places like downtown where there's new restaurants and shops going and just different community events. And so you really have this thriving small town, which I don't think, a lot of places around the US, a lot of the small towns are kind of dying and not thriving. But here in Winterhaven, it's just booming. And I love that excitement that's kind of in the air about people just really passionate about where they live.
We love it too. And there are great things coming in Winterhaven. So
That's
it's
right.
not over yet.
I love that.
So as far as your practice, what are the most common issues or symptoms that patients bring to your clinic?
So what's unique about our practice and family medicine in general is we see everybody from a day-old newborn all the way up to, I have a patient that is, in their 90s. And so we get to see everybody. We see families. I see moms and dads who also bring their kids in. And so we really get to see just every little bit of everything. We get to walk through different issues as far as like chronic conditions. So I have patients that have diabetes and hypertension that we're just kind of managing their care there. But then I also have patients that come in with acute issues like a broken arm or sniffles or, ear infections, things like that. So my day looks very different. I usually have a couple patients that are coming in to follow up on chronic conditions, a couple patients with maybe some acute issues. And then I always have some pregnant mamas on my schedule too that may be as early as 6 weeks to all the way to 39 weeks and ready to deliver. So it's always a nice variety. And it definitely makes the day interesting and fun for me.
Awesome. So kind of what are some diagnoses your clinic identifies? It sounds like pretty much the full gamut because your family practice, but specifically, are there tests or exams that you can run in-house or that you have to send them somewhere else for?
Yeah, great question. We do have resources here at our clinic. We have our own lab. So I know that we get a lot of feedback from patients that really love that. They can come here and I tell them, hey, we should probably check your thyroid today or check your blood count, see how things are going. And what's great about that is we can check it right here. So our nurse will come in and draw your blood work, and I usually can have the results back even faster that way because it just streamlines the process. We don't have any imaging facilities here at our current clinic, but we are able to get patients in for imaging very quickly through Winterhaven Hospital. They are fabulous at getting our patients in quickly. I had a patient, recently who just needed an image that day, and they were able to get them in like within a few hours. And so we do really work closely with the hospital to be able to get x-rays or CTs or MRIs, different things that patients may or may not need. The other thing is that Winterhaven Women's Hospital is right across the street from us. So I sometimes will send my pregnant patients over for an ultrasound and I can get it done pretty quickly. We also have another aspect of our clinic that we're very passionate about, which is preventative care. So making sure we're doing all of our health maintenance screening, like our mammograms, our colonoscopies, things like that. And so that's where we also partner with places like Winterhaven Women's Hospital to do our mammograms right across the street. And then we have our wonderful specialists like our GI doctors and our general surgeons that do our colonoscopies for us as well.
Awesome. Yeah, for those that don't know, your office is literally across the street from Winterhaven Women. So it's, as long as the light is green, you can make it pretty quickly. But so that's a great resource to have. So what treatment options does your clinic offer?
So our treatment options vary based on kind of what the individual needs are. We do have, our chronic condition management. So we offer diabetes treatment. We offer treatment for hypertension, thyroid disorders, treatment for that, as well as even just your basic medications that you might need. As far as like patients that might come in with, respiratory symptoms, we do have COVID flu screening as well as treatment options for that. The other thing that's unique about our practice is we do have osteopathic medicine physicians here. We have about half and half, myself included, and we do offer something called osteopathic manipulative treatment, which is something that we're all trained to do. It's a type of therapy that kind of combines physical therapy, chiropractic, and massage therapy, if you will, to try and help people with chronic pain, so back pain, hip pain, shoulder pain, those types of things, to try and manipulate the body in the way to restore it back to its natural function. So all of us that are osteopathic doctors practice that here. And I think it's a great treatment modality to try and give some pain relief to some of our patients who suffer from that.
Very nice. So most importantly, how would someone listening come in to see you?
Sure. So the best way to get in contact with our office is to give our office a call. They would call our front desk and they can schedule an appointment with me or one of my wonderful colleagues. And I can give you our phone number just to have that. So our phone number is 863-280-6080. And you can give our office a call and they'll most certainly get you in with myself or one of my colleagues.
Awesome. Well, thank you so much for joining us today. I've loved learning more about what you do and what you do with the FSU residency program and some of the different resources that we have in your office. So thank you for joining us.
Thanks for giving me the opportunity just to share. And I'm so thankful to be a part of this wonderful community.